Hi, my name is Donna Sciacca, and I'm a community outreach and education manager for the American Liver Foundation. Been with the organization for about 9 years. I'm going to be doing a liver wellness presentation. I'm anticipating about a 45-minute talk if I can get through it in that much time. This really is going to be a webinar to share why the liver is important, how people can take care of the liver, and certain pitfalls that can occur with various liver ailments. No matter who we are, really, anyone can learn more about liver health. So we are, just so you know, located in New York as our national organization, and our goals are to provide education, support, and outreach for people. We facilitate research. We conduct signature events such as the Liver Life Walk and Cuisine for a Cause. And we provide opportunities for patients, families, and caregivers to interact together. So that's why we're here. So with that, I'm going to start. Hopefully it'll move. I'm not sure if it's moved on your end. It is not doing anything on mine. Here we go. Okay, so this slide is really just to educate people about the impact of liver disease and why we should care about the liver. Liver wellness really is a way of life. It shouldn't be, hopefully, something we think about after the fact. And through awareness and action, we can help our livers do their best jobs. We may not think about the liver as much as we think about heart or lungs or other organs, but really we should. It's the largest organ in the body. It is essential to life. And in taking care of it, we can help prevent many diseases. The liver is pretty amazing. It performs more than 500 jobs in the body, and it works every minute of every day. It has an amazing ability to regenerate, which means it can repair itself. And therefore, any liver injuries may seem silent. They don't have symptoms for a long time. And that's a bit dangerous, because if someone has a liver disease that's sort of percolating in the background, but they don't feel ill, they don't realize there's a problem. And sometimes they don't get the necessary tests that they need. Over 30 million Americans have liver-related diseases. More than 40,000 people in this country die every year from a liver-related disease. Certain liver diseases appear to be on the rise. Hepatitis C, which a lot of people have heard of, it continues to affect millions of people in our country. Even though it is curable, we still see increases in infection rates. Alcohol-related liver disease continues to be a risk to liver health. A disease called non-alcoholic fatty liver disease is becoming epidemic in this country, and I'll explain a bit why later on. Cirrhosis can occur after any liver disease has been present and has caused scarring of the liver. And hepatocellular carcinoma is a type of liver cancer that starts in the liver, and this can occur among people with advanced liver disease. About the liver, well, it acts like a filter. It processes everything that we bring into our body through food, beverage, breathing in, and absorption through the skin. It helps build muscle. It helps digest food. It helps us stop cuts from bleeding. It helps kill germs, and it's a detoxifier to substances that are harmful to the body. It's centrally located in the body, but a portion of it is located under the ribs on the right side of the body. And the ribs sort of help protect the liver, kind of like if an animal is at a zoo, the bars protect the animal, the ribs protect the liver. When a liver's healthy, it's soft and smooth. It's connected to the small intestine by a common bile duct, and this carries bile formed in the liver to the intestines to digest food. So it's kind of a refinery of the body, I guess is what we call it. The liver's like a body's refinery, because all the blood that leaves the stomach and intestines has to pass through the liver before it reaches the rest of the body. It takes all the food, nutrients, drugs, or other things that we ingest, and it converts them into things that we can use and kind of dispose of the rest. A healthy liver can filter about 1.5 quarts of blood per minute, and that translates to about 540 gallons of blood every day. That's an awful lot of work for one body part to do, but you can see why it's such an important organ. This is a really helpful slide to help people understand the progression of liver disease. One of the common misbeliefs or myths is that the only thing that can really cause liver damage is drinking a lot of alcohol. While that is true, it can cause liver damage, it's not the only cause. The fact is that there are more than 100 different liver diseases, and any of them can cause this progression of damage. And the end result of that could be cirrhosis or scarring of the liver. On the far left, where you can see the images going downward, you can see the progression of liver disease. So there's a starting point of a healthy liver, and then as damage gets worse, the condition of the liver gets worse. The healthy liver is smooth, and then about midway down, you're starting to see something called fibrosis. And this is a moderate scarring of the liver. The tissue actually hardens. This means it's deteriorating. The liver condition itself is deteriorating. But fibrosis is reversible, so that's the good news. And that's why our education is so important, is if we can alert people to the fact that this can be reversed, we can reduce the number of people who actually move on to significant liver damage. If that fibrosis continues and then the damage moves into stages 3 or 4, now you've got a condition where the chance of regeneration goes down. Cirrhosis itself is a risk factor for liver cancer, and it's also a risk for liver failure, and in some cases it can be a death, cause death to people. So the larger image in the center will show the drastic difference between the healthy liver and a liver with cirrhosis and cancer. And again, this is a vital organ that we need in order to survive. So we don't have a spare. This is a very, very important point. Determining liver damage is something that you have to look at sort of like it's putting a puzzle together. I work on our helpline, and sometimes people will write to me and say, I have an elevated liver enzyme. What disease do I have? And the answer to that is, I have no idea, because it's just one portion of the diagnosis of what's going on there. Liver function tests are routinely used by primary care doctors to monitor the liver's health. So these are blood tests that measure the amount of the enzymes the liver is producing. And there should be some in the blood, that's normal, but there are limitations. So liver enzyme tests by themselves are not a meaningful diagnostic tool. They are a marker of what could be going on in the context of other information that we have available to us. One elevated liver test is not enough to diagnose a disease, but the routine testing can catch anything that's unusual. If those enzyme levels are consistently high, consistently elevated, now there might be cause for concern. But being aware of this, the elevations may be caused by other illnesses or influenced by other factors that don't affect or have anything to do with the liver. So for example, somebody who has a muscle injury can have an increase in the AST level. Sometimes people with celiac disease can have elevated levels. Certain other diseases like Paget's disease or Gilbert syndrome may have an elevation in bilirubin. Some levels can be increased when someone's pregnant because the placenta is involved, and that can affect levels. And some diseases don't even cause elevation in liver function tests until the patient reaches cirrhosis. So many people can have liver damage, but their liver continues to function just fine. So you have to look at liver function or liver enzyme tests as a puzzle piece. And other pieces of the puzzle could include imaging tests like fibroscans or ultrasounds or MRIs. Sometimes people need liver biopsies, but you have to look at it in the context of what the whole diagnostic process is. There are so many types of liver diseases out there, but the common causes of liver disease include viruses, genetics, autoimmune disease. Autoimmune disease is a situation where one's own immune system actually attacks a body part. So that's a frustrating one because it's like your body attacks you. Drinking too much alcohol can be a problem. Poor diet and obesity is actually a factor in development of liver disease. And also reactions to medications, street drugs, or toxic chemicals. About 1 in every 10 people in our country right now is estimated to have some form of liver-related disease. I want to talk to you about viruses now, and I'm probably going to say these terms repeatedly through this section, but it's always helpful to sort of go through them. These are common terms that you hear when we're dealing with viruses. Hepatitis is a word that really means inflammation of the liver. The word itself is derived from Latin, I believe. Hepa refers to liver and itis refers to inflammation. So when you think of things that are inflamed, you can think of other words like bronchitis or arthritis or gingivitis. Those things all refer to body parts that have inflammation. Hepatitis refers to inflammation of the liver, and this can be caused by a lot of different diseases, but also certainly a virus that gets into the system. An acute infection means that our bodies have a virus enter it, and we may get very sick very quickly, but the immune system can fight those off. And an acute infection is the first 6-month phase, basically, is what that means. So an acute infection can still pass the virus on to other people if people have it, if it's a contagious virus, but it may go away. A chronic infection means that someone's immune system can't fight the virus away in the first 6 months. And in such a case, the infection sort of sets up house in your body, and it may become a lifelong infection. Not all hepatitis viruses can cause a chronic infection, and some of those that can be cured by medications while others can't. An antibody is produced by the immune system when it detects a harmful substance like a bacteria or a virus that's invading the system. So you have to think of an antibody like an army made up by your immune system, and it's specific to that particular harmful substance. So for example, if you're exposed to hepatitis C, your body is smart and it knows to make a hepatitis C antibody. And that's like a little warrior that's going to try and fight off that virus. The antibodies get stored up like a library, and then your body's prepared to fight the same invader in the future. And some of these can result in what's called an immunity, meaning once you've had a situation like a certain virus, you can't get it again while others do not. An antigen is a small marker of a harmful substance like a virus that can cause the immune system to create the antibody. So the immune system uses these antigens to kind of release the correct amount of antibodies or the correct type of antibodies that are specific to that particular enemy. And then it can create new antibodies to fight the infection. Vaccine is not the same as cure, and I find that sometimes there's confusion about that. A cure treats something that's already been diagnosed. A vaccine imitates the infection but doesn't cause the illness. So the vaccine is a prevention tool. It teaches your immune system what to recognize so that it can't hurt you in the future. So these really create kind of a safe and natural protection because it works with your own body's natural immune response. So vaccines are good, antibodies are good. Those are our friends. We like those things. Hepatitis virus within our country, it's really primarily hepatitis A, B, and C that we see here. There are other types, but we don't see them as often in this country. And this chart, I think, is a pretty handy way to just sort of recognize the differences or the similarities in them. So a few basics. All of these viruses are contagious, which means that if somebody has a hepatitis virus, he or she can pass that to other people. And this is called transmission of a virus. Again, the vaccine is what we get to prevent infection, and a cure involves taking medication to get rid of the infection once we have it. Acute means infection happens, the virus is in your body for 6 months or so, and then it goes away because the body successfully fought it off. Chronic means that the infection stays in the body, and in some cases it doesn't ever go away unless medication can cure it. So I'm going to go through these a little bit in detail for you. Hepatitis A is transmitted through fecal matter that travels from person to person through food or water. This is an acute infection. It doesn't tend to become chronic, so you get it, it does its thing, you feel lousy for about a few months or so, and then it goes away. Some people feel like they have the flu. They might sort of get a yellowish tinge to their eyes or their skin. Most people don't even necessarily know they have it. If they get it, within a few months, it's generally gone. Usually not serious, but again, you can feel lousy when you have it. There is vaccine against hepatitis A, but the best way to prevent this virus from hurting us is vaccine and hand washing. Just thorough, good soap, warm water hand washing, and just making sure you wash hands after using the bathroom or changing a diaper. That way your hands are clean, and avoid consuming contaminated food or water. sometimes traveling outside the country, if sanitation standards aren't as good elsewhere, you'd want to be vaccinated too. Hepatitis B is transmitted person to person through infected blood or body fluids. This is contagious through sexual fluids. So there's always a lot of confusion about which one is sexually transmitted. Hepatitis B would fall into that category. Like hepatitis A, hepatitis B can make you feel sick for a short time, and then you can feel better. And as with hepatitis A, most people who have hepatitis B are asymptomatic. That word means that you show no symptoms. Most adults will be able to fight hepatitis B virus with their own immune systems. But in some cases, maybe 5 to 10% or so, hepatitis B can become a chronic condition. And this can lead to some very serious problems that can lead to severe liver damage, liver cancer, and possibly premature death, which is very sad. About 1.25 million Americans are currently infected with hepatitis B, but there is a vaccine that you can get to protect yourself against this particular virus. Hepatitis C is transmitted from person to person through infected blood. It does not travel through any other body fluids. It doesn't travel through the respiration system. It is blood to blood only. Unlike hepatitis B, most people cannot fight this off on their own with their immune system. The Centers for Disease Control kind of estimates that we're at about a 75 to 85% rate of people who become infected with hepatitis C and move on to a chronic infection. And this can be a very serious disease that can lead to liver damage, cirrhosis, and premature death. The estimate right now is about 3.5 million people in this country who have hepatitis C, and most people don't know they are infected because they don't look or feel sick. As many as 75% of those infected don't even know they're infected because they have no symptoms. And that's kind of scary because you can be walking around with a virus attacking your liver and you feel fine. This is one of the most common reasons for liver transplantation in this country. So prevention is really the key to it all. We certainly want to talk to people about getting tested and treated, but prevention is really a goal. And there are several new treatments nowadays that make hepatitis C a much more curable disease than ever before. Now, one thing that's important to note here is that people who've had hepatitis C and have fought the virus off with their own immune system, or even those who have taken medication and been cured, can be reinfected. And this is a little bit different than what happens with other viruses. You're never really immune from hepatitis C. So it's really important for people to understand that if they've ever been exposed to somebody's blood or if they've ever had this disease, they shouldn't have a false sense of security that they are never, ever able to be infected again, because unfortunately that would be a false presumption, and we don't want people to feel that way. I want to talk a little bit more about each of these viruses just to solidify the understanding about them. Hepatitis A, again, there's no treatment for hepatitis A. If you're diagnosed with this, the doctor doesn't write you a prescription for the illness. People are generally instructed to try to get some rest, drink a lot of fluids, and try to eat a healthy diet. You want to shore up your body's strength to get through this virus. You might want to take something if you're having nausea or some other side effect of it if you're experiencing that, but there's no cure for hepatitis A. So people do generally clear this on their own within 6 months. And again, vaccination is the best way to prevent the infection. Talked to you already about the hand washing, making sure about safe food preparation. Folks who work in facilities like nursing homes or daycare centers would be vaccinated for this, because these are things where they might be handling soiled linen, soiled diapers, things of that nature. And sexual transmission of hepatitis A actually is possible. So use of a barrier for any kind of oral or anal sex would be advisable as added safety. Right now, vaccination is strongly recommended for certain populations of people, and that would include children under the age of 1, people who travel internationally, people who've had direct contact with somebody with the infection, men who have sex with men, people who use or inject drugs, and people with other long-term liver diseases, and people experiencing homelessness. Again, if somebody's homeless, they may not have access to, cleanliness or other things that could keep them safe. For hepatitis B, again, as with many other diseases, hepatitis B is diagnosed through blood tests, and during this acute phase of infection, Again, doctors would not prescribe a medication because within 6 months, it's possible that your body would fight it off on its own. So rather, they emphasize the resting, the drinking of fluids, and the consumption of a healthy diet. If hepatitis B isn't cleared by your own immune system within 6 months and it becomes chronic, now we're talking about possible prescription of medications or probable prescription of medications to slow down the progression of that damage, because now you know there's a virus that's there, it's taken up residency in the body, and you don't want it to hurt the liver. So there's unfortunately not a cure for hepatitis B, but the medications that are prescribed can do a pretty good job of managing the disease for people. And it can also help preserve liver function of the person who's infected. So someone would really need to work closely with a doctor to be monitored and get those treatments. Vaccination can even just prevent the whole problem altogether. And along with other risk reduction practices like condom usage, avoidance of sharing any kind of equipment to use drugs, things like that. So harm reduction and vaccination are the keys to this. And over at the far right here, you can see the current recommendations for people who should be vaccinated against hepatitis B. So again, anyone who's in a medical setting, for example, infants, people younger than 19 who are not vaccinated probably should think about getting vaccinated. Any kind of sexual contact with a potentially infected partner, people who are at risk for exposure to blood, because blood and body fluids would be how Hep B would travel. International travelers, anybody with chronic liver disease of any type should be vaccinated. You don't need two problems going on at once. Folks with HIV and people who are in jail should consider being vaccinated if they are not already. So again, here's more Hep B testing recommendations. And this again goes through antigen and antibody testing. So that's something to be considered here as well. Hepatitis B surface antigen is something to be detected in the blood when someone has the virus. It will not determine if the virus is chronic or acute. That's the difference there. It'll tell if it's there, it just can't tell how long you've had it. If it's positive, that means that the virus is in the body and can be transmitted to other people. And if it's negative, then the virus is not in the blood. Antibody testing means that the antibody can be produced by the body in response to the Hep B antigen. Positive means the person's protected or immune, or they've had the virus and recovered. And the antibody itself is produced only in response to the part of the active hepatitis B virus. So either the person is currently infected or was infected in the past. But more tests really need to be determined to figure out whether or not this is an active infection. Hepatitis C testing, treatment, and prevention. Well, if anybody's ever, this is a tough one because people tend to associate hepatitis C solely with intravenous drug use. And while that's a valid way it can travel, it is not the only way it can travel. But even for those people who are not in that situation, we have to just get the word out about the many ways this can travel. Injection drug use is one of the biggest hepatitis C risk factors, as can be sharing a snorting straw or a crack pipe. Anytime there's a blood vessel or an unhealed sore that can transmit blood from person to person is a risk. So just looking at this graph here on the right, I want to point you to that direction here. If you've ever seen commercials about hepatitis C, there was an emphasis on baby boomer, baby boomer, baby boomer. And that's true, that risk group is certainly valid. But look what's really happened here. We've got a lot of infection rate among millennials and Gen Xers too. So we know that this could be in part due to the opioid epidemic, but it just goes to show that it's not just a baby boomer disease. So those commercials probably may have given people an impression that it doesn't affect anybody else. So treatment has gotten much better over the years. I'll talk a little more about that, but this is now over 90%, between 90 and 95% of people can be cured now. It can be prevented by simple things like not sharing equipment to use drugs, making sure that you're always going to be using sterile tattoo and piercing equipment and single-use ink, avoid sharing toothbrushes, razors, nail clippers, use of condoms and lubrication for sex, and getting tested. Just getting tested will help. It's gotten more common, unfortunately. In 1992, this was sometimes or commonly spread through blood transfusions. We didn't know what hepatitis C was before 1992. But now, with widespread screening of the blood supply, this has eliminated much of this risk. New infections were 4 times as high in 2018 as they were in 2009. So that shows that things are spiking, and it is increasing among that younger group because of the opioid epidemic. Testing, we're really encouraging testing. This is incredibly important for people to be tested. Hepatitis C testing is really strongly recommended for anyone who is 18 years or older, and this is a fairly new recommendation through the Centers for Disease Control. Every pregnant woman should also be tested for hepatitis C, and anyone with even one risk factor mentioned already should be tested on a regular basis. This is just an incredibly important thing. Blood testing is the way hepatitis C is diagnosed. The hepatitis C antibody test will determine if a person has ever been exposed to the virus, but it does not diagnose you for the ongoing infection. So remember, those antibodies are the soldiers that are defending the territory against the enemy. If hepatitis C was ever in your body would produce antibodies to fight it off. So if your hepatitis C antibody test is positive or reactive, as I mentioned with the other type of test, that means that the virus was in your body at some point in time. If the hepatitis C antibody test is negative or non-reactive, then that means that the person was never exposed to the virus. Now, here's something that's important to note. It can take 3 to 12 weeks for the body to develop antibodies to this infection. So if somebody had a recent exposure, let's say that I decided to get a tattoo, and I got the tattoo at my college dorm room 2 weeks ago. And then I find out about hepatitis C. So I go, oh my goodness, I better go to the doctor and get tested. So, 2 weeks from the tattoo, I go to the doctor, I say, I need a hepatitis C test. They do the antibody test and it comes back negative. And I'm going, wow, breathing a sigh of relief, I'm safe. Possibly not, because it may not have formed antibodies in my system yet. So you have to really look at waiting 3 to 12 weeks for the body to develop those antibodies to make sure you're getting an accurate reading on the test. Otherwise, you may have a false sense of security that you were not infected. Now, again, remember, the acute stage of infection is the first 6 months, and that's when the virus is in the body and your body's trying to fight it off. During this phase, about 1 out of every 4 people will actually clear the virus on their own just through the power of their immune systems. The antibodies have done their job, everything's good. This is called self-clearing. People who self-clear will always show positive for the hepatitis C antibody test, but the virus itself, the thing that actually causes the liver damage, is gone. The antibodies aren't contagious, but the virus is contagious. Antibodies don't harm the liver, the virus harms the liver. So I'm not going to equate measles to hepatitis C, but I'll give you an example. When I was about 7, I had the measles. So if I went to the doctor today, I'm now older, much older, and said, geez, I can't remember if I ever had the measles. Can you check me for measles? They would run a measles antibody test on me, and they'd say, yeah, we see the measles antibody. Does that mean I currently have measles? Am I contagious for measles? No, it was there before. I was contagious before, but the antibodies have remained. They're not hurting me, and I can't pass measles on to other people. So it's the same thing as hepatitis C in that regard. Now, the antibody test, again, it's not a final diagnosis of hepatitis C. If the result is positive, that's just showing that you were exposed. That would warrant the next level of testing, which is called a viral load test, or sometimes it's called an RNA test. Doctors need to determine if the virus is still in the body, if the virus is there attacking the liver, and that's what the viral load test will detect. Someone with a positive viral load test is contagious to other people. Someone with a negative viral load test is not contagious to other people, and they themselves do not have an infection in the body attacking the liver. If a person has a positive viral load test, that person would need additional testing to determine what the best treatment would be. And these tests can involve more blood work, It can include something called a genotype test because there are 6 hepatitis C genotypes and some are more common than others. And they might need tests that take pictures of the liver. So that could be, an ultrasound, it could be a CAT scan, it could measure stiffness of the liver, or possibly analyze small pieces of liver tissue to see if any fibrosis or cirrhosis is present. So it may take some testing to figure out what's going on there. It's, again, puzzle pieces. So that's the world of viral hepatitis that we've just covered. So feel free to, think about that a little bit and review that information. Now I'm going to move on to non-alcoholic fatty liver disease. Liver disease, again, often is associated with alcohol, but in reality, non-alcoholic fatty liver, or NAFLD, we abbreviate it to NAFLD, is a disease that affects people who drink very little or even no alcohol. There is an association of obesity with NAFLD, but someone can actually have a normal body mass index and still have fat buildup in the liver. So if NAFLD isn't diagnosed and steps aren't taken to reverse the fat buildup, the problem is that damage can progress to cirrhosis in a portion of the people who have this. That can get very serious. What you're seeing here are risk factors for NAFLD. Some of it is associated with overweight and/or obesity, type 2 diabetes, heart disease, hypertension or high blood pressure, high cholesterol or high triglycerides, and even certain drugs that we take may contribute to fat buildup in the liver. So some of these are called comorbidities, or conditions that are often seen together in various individuals. Now, this is the hard part. When I talk to folks who've been told they have NAFLD, they want to know what medication they can take to get rid of it. And the answer I have to say to them is that scientists are working on medication to treat NAFLD, but right now we do not have one that is approved for use. So what we're looking at now as a treatment per se for NAFLD is behavioral change, which is a change in diet and physical activity habits. And that's probably harder than just taking a pill a day. Changing behavior can be very challenging for people. So it's important for people to speak with their doctor or even a nutritionist to try to put together an eating and some sort of physical activity plan that works for them. Some guidelines do exist on the types of foods to eat. Quantity, portion control is certainly important, but that's really the angle of attack when it comes to NAFLD. I want to point out here, and I think it'll come up again a bit later, that somebody with any type of liver disease, including NAFLD, should strongly avoid drinking alcohol because alcohol is toxic to liver cells on its own. So when your liver already has some sort of a problem going on, adding alcohol into the mix can make the liver disease get worse, and that certainly would be a sad state of affairs. So it's just kind of an awareness of intake and what you're putting in your body. Into this category as well would be caution with taking dietary supplements. Certain vitamins and minerals, and for example, I would use vitamin A or iron or niacin, can be harmful to the liver in higher doses than necessary or prescribed. And I think sometimes when people find out they have a health problem, they want to take a lot of vitamins because they associate that with being a healthy person. But you just have to be very careful and check with the healthcare provider about taking anything additional when you have a liver problem like this. You don't want to just take things labeled natural and presume it's safe. Sometimes supplements can have a bad interaction with other medications. It might make the other medications less effective, or it may cause negative side effects. So these are just important things to remember when it comes to fatty liver. Now, we are not dietitians and nutritionists at the American Liver Foundation, but we do know a few things that are helpful when it comes to nutritional changes when it comes to NAFLD. Food groups and their quantities used to be done in a kind of an old-fashioned way called a food pyramid, and we've now seen a change in that, where we now look at a balanced type of plate, a balanced type of eating plan. Everyone really has to look at their own preferences with what they like to eat. So certain cultures, for example, they would find certain foods very boring, or they prepare foods in a very different way than other cultures. So a lot of things factor into how we choose to eat, but we do know that an encouragement of eating more vegetables, fruits, whole grains, low-fat dairy, and lean protein foods tend to be a good start on a healthier eating plan. Trying to limit sodium, which is also called salt, or added sugars are helpful as well. And trying to limit saturated fats, which are found often in animal products and certain oils. Things like lard and butter would be considered more of a saturated fat than something like olive oil, which is considered sort of a healthier fat. And the food label that you can see there on the right is another healthy tool. Being aware that if a label says that something is a serving size of 1 cup, then everything that's listed there in terms of calorie, fat, cholesterol, sodium applies to 1 cup serving size. But if you have 2 cups, you have to double all of that other information to get an accurate total of what you're consuming. Over on the left, we don't always carry measuring cups with us. So how do we know how much we're eating? Well, we can actually use our hands and our fingers as measuring tools. We can use our fist to measure about a cup. We can cup our hands, and that's about a half a cup. If you have the palm of your hand, that represents about 3 to 4, maybe 5 ounces of different types of meats or proteins. Your fingers can be used to estimate things like tablespoons and teaspoons. So we do have, right on our bodies, we have ways we can assess this sort of thing. And it's just a learning process. It really is. Again, trying to avoid alcohol would be important. So these are just tips on nutrition. And also for physical activity, it doesn't have to be 3 hours at a gym. Housework can be physical activity. Some sort of sustained activity just to burn some calories and move around can be helpful to people. And I think that can be daunting if people are thinking about, oh boy, I have to join a gym and I have to do this and I have to do that. They really don't. They just have to get up and move a little bit more often and pick something they enjoy doing so they'll stick with it. And we come to alcohol in the liver. Oops, I went too fast, excuse me. Try to back that up. Alcohol itself comes in many, many forms. So it can come in terms of hard liquor, beer, wine, and malt liquor. 1 serving of any type of alcohol contains about as much alcohol as 1 ounce of hard liquor. So I want to really drum home the point here. I've had people say, I don't really drink alcohol, I just drink wine. And wine counts because it contains alcohol. You can see here some of the standard serving sizes of alcoholic beverages and what excess drinking would be. So a binge drinking episode would be 4 to 5 servings of alcohol within a 2-hour time frame. Heavy drinking shows for men and women, because it is slightly different, 15 or more drinks a week, 8 or more drinks a week. So people have to kind of keep this in mind as a benchmark of how much they're consuming. The liver actually needs water to process alcohol from our systems. Any type of liver disease, again, alcohol can make worse. Just looking again at serving sizes, types of alcohols that are listed here. Bottom line is we have to be very careful if we want to keep our livers healthy if we choose to consume alcohol. Alcohol combined with medications and drugs can be harmful to the liver. And also something to note here, it's important to watch alcohol intake if people are obese or if they smoke. Recent studies are suggesting that a combination of alcohol, tobacco, and obesity appear to work together to increase the risk of liver cancer. So this is something to keep our eyes on and to keep our awareness about. Alcohol-related liver disease, unfortunately, is one of the major causes of cirrhosis in this country, and it's certainly nothing to be ashamed of. It's more an awareness and helping people understand how this substance affects the body. When we use the term drug-induced liver injury, people often jump in their mind to street drug use, and certainly there can be damage to the body from street drug use, but it's also a risk for all kinds of drugs. So it's important to really read instructions on prescription medications as well as non-prescription medications. And non-prescription medications are referred to as over-the-counter drugs. It's very important to understand, again, that supplements can either cause liver damage on their own or they can interact poorly with other medications people may be on. It's a really good rule of thumb to make sure your doctor knows about every single drug you put into your body, whether it's a prescription drug, an over-the-counter drug, or a supplement. Reading instructions will really provide information on how much to take, how often to take it, whether you should take it with food or beverage, and other important information. Just so by following instructions, you can reduce the chance that your liver and other organs will suffer damage. I actually had a chat yesterday on our helpline with a woman who was told to take a medication every 4 hours, and she decided to take it every 3 hours because she felt that by taking it an hour earlier, it would somehow strengthen the medication within her system. And unfortunately, that product contained acetaminophen, which can be toxic to the liver in large quantities. So I had to tell her to please not do that so that she wouldn't hurt herself. Be very cautious about products advertised as liver cleanses or body detoxes, because there's really not necessarily clinical evidence on these products that show that they help us. And in fact, there have been unfortunate cases in which some of these products have actually caused harm to people. Again, always talk to the doctor before you try any product of this type, just to make sure you know what you're getting and what it may do. If you're on a prescription medication for a health problem, one thing the doctor should do is to monitor your organ function by taking blood tests periodically. And if they do that, they can catch something if it appears to be affecting your liver, and the doctor can adjust those medications or address the problem early on before there are issues. The liver's really busy trying to remove these poisons that we breathe in from the air, including exhaust, smoke, and other chemicals. So just be careful when using household cleaners, bug sprays, anything that could be toxic to the system. And again, I mentioned the acetaminophen issue a bit earlier. This is a compound that's found in hundreds of medications. They're found in prescription and non-prescription drugs. And again, if it's taken properly, most people don't have a problem with this. The issues arise if they're taking this in excess. Acetaminophen overdose can be avoided just by following these simple guidelines. And I sort of went over them a little bit earlier, but just looking at whether your medicine contains acetaminophen, reading how much to take, how often to take it, look at how much you should take in a 24-hour period. And if you're taking more than one medication, make sure that they don't all contain acetaminophen, because that can lead to an accidental overdose. And I'll just pick on a couple of names here. Say you're taking Tylenol. Well, that contains acetaminophen, but then say you want to take some NyQuil too. That too contains acetaminophen. So you're doubling up on the dose without even knowing it if you don't look at those labels. For most people, if you're healthy, taking about 4,000 milligrams of acetaminophen a day shouldn't pose a problem. But if you go higher than that, or if you have other medical conditions where this amount may not be good for you, that's when liver damage can occur. So the makers of some of these drugs have lowered the acetaminophen recommendation to 3,000 milligrams just to be safe. So that's a good rule of thumb, 3,000 to 4,000 milligrams a day maximum, so that you don't wind up having a problem you didn't count on. We've just talked about some of the common liver diseases, but there are other ones that affect people, and they're less common, but it doesn't mean that they're any less serious. Autoimmune hepatitis actually affects more women than men, often younger women. We don't really know quite what causes it, but we think it's a genetic or environmental triggered illness. And it's where your immune system sees your liver as an invader and attacks it, and it leads to a lot of problems with the liver. Biliary atresia typically affects babies, and again, causes are unknown, but possibly environmental triggers of some sort or a genetic mutation. The bile ducts are affected, and they're unable to drain bile from the liver, and this can cause damage. Hemochromatosis is another one. They call it the Celtic curse for some reason, but more men than women are likely to have symptoms. They think it's hereditary in most cases, possibly some sort of genetic mutation. And it's a condition in which excess iron is stored in major organs, and over the years, this can lead to organ failure or chronic illness. PBC, or primary biliary cholangitis, is, again, unknown cause, believed to be autoimmune with some genetic environmental triggers. And it's when the immune system attacks healthy cells and it leads to inflammation and damage of the small bile ducts in the liver, preventing the flow of bile. And finally, PSC, or primary sclerosing cholangitis, again, unknown cause, possible genetic or environmental triggers, inflammation that slowly damages bile ducts inside and outside the liver, causing scars to form. And this makes the ducts hard and narrow, and it prevents the flow of bile. So we don't hear much about these illnesses, but after I got a job here, I found out that a friend of mine had one of them. So you just never know who may be affected and how it may affect their lives. We hope people don't wait until they have a lot of signs and symptoms of disease. But again, with the liver, because it is it's a silent sufferer in many cases, and we don't have symptoms early. Anytime we see things like a yellow discoloration of the skin or the eyes, that should be an indication where someone should take note. Any sort of abdominal swelling or severe abdominal pain would be cause for concern. Really prolonged itching of the skin, not just a little itch, but just an itch that won't go away, could be problematic. Very, very dark urine or pale, bloody, or tar-like stool would be cause for concern that could point to a liver issue. Chronic fatigue, nausea, or loss of appetite, loss of sexual drive or performance, and any sort of unusual sleep disturbance or mental confusion. These are all things people should be aware of, and certainly a doctor should be consulted if any of these things are happening, so that the appropriate tests and possible treatments can be employed. Anyone who wants more information should certainly contact the American Liver Foundation. We have a variety of ways of following us, whether it's our website or Facebook and other social media platforms. And we encourage people to do online research, but we do want people to search in reliable places. So we recommend things like the local Department of Health, Centers for Disease Control and Prevention, National Institute of Health, choosemyplate.gov, and knowyourdose.org. These are all reputable websites where people can get good, helpful information. So with that, I'll close. Thank you for listening, and I hope this was helpful to you.